Now, if we want to prepare the gram-positive cocci for the exam, first of all, we should know the basic salient features of the gram-positive cocci. The gram-positive cocci first of all divided into streptococci and staphylococci. All these streptococci, they are catalase negative, while all the staphylococci, they are catalase positive. They are further divided on the basis of the presence of the enzyme coagulase. So, the staphylococci which are coagulase positive, they are the Staph Aureus, the most important one. And then we have another very important university question, discuss the coagulase negative staphylococci. They are the two. One is Staph Epidermidis and the other one is Staph Saprophyticus. They are very easy, they are very simple. The epidermidis, it is basically the normal flora of skin. It also produces a slime layer which helps it to attach to the prosthesis if there are any prosthesis in the body, and it can cause endocarditis if it enters into the blood. However, if it remains at their normal place, which is the skin, they are very beneficial there. And Staph Epidermidis, it is novobiocin sensitive. This is a very important diagnostic point if in the exam you are asked to write it, lab diagnosis. So the Staph Epidermidis is a gram-positive coccus, catalase positive but coagulase negative and novobiocin sensitive. Now when we come to the Saprophyticus, the Staph Saprophyticus is the second most important bacteria after E. coli to cause urinary tract infection in the females. The first most common is E. coli, and E. coli is a gram-negative rod. So this Saprophyticus, it causes UTI in the females, and Saprophyticus is novobiocin resistant. So this is a very easy and simple format to remember the salient features of the Staph Epidermidis and Saprophyticus. Now we comes to the Staph Aureus. Now very few important points about the Staph Aureus which you should always write in your written exam if you are asked to write its lab diagnosis. The Staph Aureus is a gram-positive coccus. They are always in the form of grape-like clusters, while the streptococci, they are always in the form of chains. The Staph Aureus, they are gram-positive coccus, they are catalase positive, they are coagulase positive, and they all have the golden yellow colored colonies on the blood agar, where they also show the beta hemolysis. So this is a very important characteristic. And apart from the blood agar, the Staph Aureus, they can also grow on a special culture media which is called the mannitol salt agar, because the Staph Aureus, it ferments mannitol. So the most important basic features about the Staph Aureus, never to forget, they are gram-positive cocci, they are catalase positive, they are coagulase positive, they produce golden yellow beta hemolytic colonies on the blood agar, they are in the form of grape-like clusters on the gram stain, and they can also grow on a special media called the mannitol salt agar. Now the Staph Aureus, it is one of the most important bacteria in the hospital infections. A lot of various types of infections are caused by it. On the whole, it can cause septicemia in the ICU patients, it can cause sepsis, it can cause osteomyelitis, it can also cause endocarditis, but this endocarditis is right-sided endocarditis, usually in the IV drug abusers. Then it can cause pneumonia in the hospitalized patients, and this pneumonia is lobar pneumonia. Then very different types of skin infections can be caused by it. Carbuncles. Commonly in the Urdu, the carbuncles, जब पेशेंट आएगा तो वो कहेगा जी फोड़े निकलते हैं बहुत ज़्यादा मुझे, ठीक है, तो दे आर कॉल्ड द कार्बंकल्स. देन वी हैव furuncles. Then simple folliculitis at the corners of the nails. Some people they have a specific kind of accumulation of the pus. It is called paronychia. Stye, आपके eyelids में pus की accumulation है. It's called stye. So too many various kinds of the accumulation of the pus in the skin, various types of skin infections, various types of other septic infections. The Staph aureus is the most common culprit here. Then these are all the infections. They are caused by the pyogenic inflammation. Apart from these pyogenic conditions, the Staphylococcus aureus, it also produces some specific exotoxins. Now, what are these exotoxins? These are 3 exotoxins. They are very important. The one is enterotoxin. The second one is toxic shock syndrome toxin. And the third one is exfoliating toxin. You should know their mechanism of actions. The enterotoxin and toxic shock syndrome toxin, they both are superantigens. The superantigens are those antigens which can produce a large number of interleukins by bypassing the common processing mechanism of the antigens. While the exfoliating toxin, it is an protease and it causes scalded skin syndrome in children. The toxic shock syndrome toxin, it causes toxic shock syndrome. This toxic shock syndrome, the females can suffer from it if they use tampons in their menstruating days. In the nose bleed, if their nose packing is used, there it can cause toxic shock syndrome. And enterotoxin, it commonly causes food poisoning. And this food poisoning is usually caused if you have eaten the pastries, cakes or the mayonnaise containing food. Now, what are the 2 most important enzymes which are produced by the Staph aureus? Obviously, they are catalase and coagulase. Then they also produce DNase, they also produce staphylokinase. So these are the important and salient features. The clinical scenario will be of one of these diseases. Diabetic patients, they can also suffer from Staphylococcus aureus infections. Hospitalized patients, they can suffer from the Staphylococcus aureus infections. Then there is also one of the type of the Staph aureus which is called MRSA. They are methicillin resistant Staph aureus. They cannot be treated by the common cell wall inhibitors. You can use vancomycin for their treatment. So these are the common salient features which you should at least remember to pass the exam. Thank you.